If you want to learn everything you need to know as a nurse about cellulitis, then this is the video for you. Cellulitis is a fairly common bacterial infection of the dermis and subcutaneous tissues of the skin. It most commonly affects the skin of the legs, but can occur anywhere on the body. Streptococcus and staphylococcus strains of bacteria are the most common cause. However, any type of bacteria can cause cellulitis. In most cases, cellulitis is not contagious. However, there is a risk if a break on your skin comes in direct contact with an active infection. And finally, cellulitis itself is not life-threatening, but if left untreated, it can result in life-threatening conditions such as bacteremia and sepsis, osteomyelitis, endocarditis, and gangrene. Cellulitis can occur when there is a break in the skin, which acts as a point of entry for bacteria, such as with a surgical incision, insect bite, animal bite or scratch, eczema, or a wound. Additionally, comorbidities such as diabetes, venous insufficiency, peripheral arterial disease, and lymphedema increase the risk of developing and having a severe case of cellulitis. Signs and symptoms of cellulitis include a rash that is red or pink on light skin tones, brown, gray, or purple on darker skin tones, warm, tender, and painful to touch, may appear swollen, pitted like an orange peel, have fluid-filled blisters called bullae, purulent drainage, yellow crust, or an abscess. Some cases of cellulitis may present with flu-like signs and symptoms, such as general malaise, fatigue, chills, fever, and body aches. Diagnosis of cellulitis is generally based on history and physical exam. However, if there is suspicion of a systemic infection, a blood culture and sensitivity will likely be ordered. Furthermore, if the infection is not responding to treatment, a wound swab or a sample of the tissue may be collected to identify the type of bacteria. Treatment of cellulitis can occur as an outpatient or inpatient, depending on the severity. Oral or intravenous antibiotics are used to treat cellulitis. Intravenous antibiotics require hospitalization and are used for more severe cases of cellulitis. This includes failed oral antibiotic treatment or a rapidly spreading infection with possible systemic involvement. Generally, cellulitis will improve within 24 to 48 hours after starting appropriate antibiotic treatment. It is important that the entire course of antibiotics is completed, even if feeling better, to avoid developing an antibiotic-resistant organism, also known as an ARO, such as methicillin-resistant Staphylococcus aureus, also known as MRSA. Additionally, it is a good idea to mark the perimeter of the rash to be able to assess response to treatment. The infected area should also be gently palpated to assess for an abscess. If an abscess does occur, it may need to be surgically drained. Furthermore, if the area of infection is edematous, keeping it elevated to reduce edema is important and will help with healing. And finally, it is important to keep the infected area clean, dry, and covered with a breathable dressing. Since it is possible for cellulitis to reoccur, prevention is key. Any skin breaks should be immediately cleaned and antibiotic ointments, if appropriate, should be applied. Open wounds should be covered with a dressing or bandage and changed daily. Skin conditions such as athlete's foot or eczema should be treated and well controlled, and dry cracked skin should be moisturized to maintain skin integrity. And finally, individuals at increased risk of cellulitis should assess their skin daily for wounds or infections. This wraps up everything you need to know as a nurse about cellulitis. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!